Diets during pregnancy. Welcome to our channel. Today we will talk about diets during pregnancy. We also recommend that for more information, review the information that we give you at the end. Motherhood is a wonderful experience of a woman. Nature ensures the continuance of living beings through their progenies, human beings being no exception to this universal rule. The development of human consciousness and scientific advancement though has put some restrictions or exceptions to the very purpose and end of a man-woman relationship. It is the nature's design for obtaining progeny and thereby ensuring the continuance of the human race. Diet is an important factor to be taken care of during the pregnancy. One has to bear in mind that one has to eat for two during pregnancy, though overeating is not the remedy for this. One has to take sufficient quantity of proteins, vitamins and minerals since the mother is the only source of all these essential items for the baby. Prenatal diet: do not recommend complete non-carbohydrate diet since it may result in production of ketones in the bloodstream in the absence of carbohydrates, that may result in the risk of brain damage for the baby. Besides, this also may lead to constipation in pregnant women since they are supplied with additional doses of iron required for the baby. The prenatal food need include enough fruits to ensure vitamins in required quantity. One need be careful not to overeat, that may lead to obesity, especially those who suffer from diabetics or low BP or overweight. Normally low carbohydrate diet includes whole grains and fruits with minimum white rice and pasta. If one take high carbohydrate diet, it is better to go for frequent meals. One may avoid processed meat as it contains less nutrients and more calories. Sufficient quantity of nuts, salads and fruits are to be taken. Large doses of salt and sauces are to be avoided. One is best advised to consult the gynecologist to get a balanced diet prescribed. There is definitely a connection with the prenatal food and the baby's health. One has to prepare oneself to be a good mother by enriching the knowledge of baby care and the post-delivery health care. One needs to be emotionally prepared to keep adjusted with the physical and emotional changes one is subject to during this period. The role of a loving husband during the period cannot be overemphasized. It is he who has to give her the care, comfort, and the confidence to prepare herself to become a matured, healthy and loving mother. This article is to be used for informational purposes only. The information contained herein is not intended to be used in place of, or in conjunction with, professional medical advice regarding pregnancy. Prior to beginning any diet or taking any medication, the patient must consult a licensed medical doctor for advice and/or to determine the best course of action for his/her individual situation. This is all for this video. For more information and so you can download an ebook, we recommend that you go to the link that is at the bottom, in the description.